Hello viewers, welcome to Owotunde TV. In today's video, I'm going to be talking about chemotherapy. Just a couple of days ago, I received a WhatsApp video from one of my mates, and in that video, there is this lady talking about chemotherapy. She's actually, discouraging people from taking chemotherapy. She's advising them to stop taking chemotherapy because, according to her, she believes chemotherapy is the one killing people. It's not actually the cancer that is killing people. I think she lost someone to cancer, and that person died while taking chemotherapy. So therefore, she believes chemotherapy is bad for cancer treatment, and the people need to stop taking chemotherapy. Also, she went as far as saying that doctors do get some kind of commission based on the number of chemotherapy they give to patients. So that's why they are forcing chemotherapy on cancer patients. For me, I couldn't disagree more with that statement, because based on my own experience, I live in the UK, and in UK, doctors don't get commission based on the kind of treatment they give to patients or how many patients they treat. So they actually get paid based on the number of hours they work. They get either hourly pay or monthly or weekly pay. So the number of patients they treat or the level of drugs they prescribe to patients doesn't determine their income. It is the number of hours they work that determines their income. So that's why I've decided to make this short video. I would like to start by explaining what chemotherapy is all about. So what is chemotherapy? Chemotherapy is a cancer treatment where medication is used to kill cancer cells. So that's very simple. So the way it works is this: the chemotherapy, when it goes into the body, it kills the cancer cells from growing, from reproducing, or from spreading around the body. So that is what chemotherapy does. It kills cancer cells. And the cancer itself, its stages, there are 4 stages of cancer. When cancer is at the early stage, maybe like a stage 1 or 2, it is treatable. That is why it is always advisable to go for medical checkup at least once every 6 months, if possible, more than that, but at least twice in a year. It is advisable to go for a checkup just in case there is any problem. They can treat it on time. So when cancer is at the stage 1 or 2, it can be treated. But when you get to stage 3, it is very, very difficult. Finally, when you get to stage 4, it's not curable at stage 4. It is difficult to treat a stage 4 cancer. So that is why, like I said earlier, to go for medical checkup all the time. So chemotherapy does not kill anybody. It is a cancer treatment that kills cancer cells. And there are different types of chemotherapy. There are different ways to pass chemotherapy into the body. The first one is given into the vein through a tube, and this is usually done in the hospital. And the second one is chemotherapy drugs. This involves taking a course of medication at home with a regular visit to the hospital. And with this kind of treatment, if you are taking chemotherapy drugs at home, you need to be very careful. You need to be mindful of people living around you, especially your partner, your children, your relatives. You don't want them to have contact with your body fluid, because this could harm them. Even though they are healthy, it can still harm them if they get contact with your body fluid while taking chemotherapy treatment. And also, if you go to the toilet, you need to clean up, flush the toilet more than once, maybe twice or even 3 times, just to make sure you get rid of your body fluid. Nobody get contact with your body fluid. Another way to pass chemotherapy is, it can be done through, it can be done by passing it to the spine. And they can also give it under the skin or into the vein. So there are different ways. This can be also done, through the arm they can pass it, through the skin and all that. So there are different ways the doctor will pass chemotherapy to the patient. So once somebody is diagnosed with cancer, the doctors usually perform series of checks, tests to determine the level of damage or the kind of cancer the person has, and this will determine the kind of treatment they will give to that person. So these tests may include blood tests, X-ray, scans, and even so also they can also take the measurements of the height and weight. So, at the end of the day, they will draw a plan and determine or decide which treatment the person will need, how long is going to need that treatment for, and the type of chemotherapy they will give to that patient. So that's another thing that woman was saying in that video. She said chemotherapy is very, very painful. When you take it, your body will be dead and all that. So based on my own personal research, the chemotherapy process itself is painless. It's not painful. Even though when it gets into the body, it may cause some burn. And this usually takes a couple of days for the body to break it down and get rid of the drugs in the body. So it takes the body 48 hours to get rid of the chemotherapy treatment. So it's not the end of the world. It might be painful, but only for not more than 48 hours. And just like any other treatment or drugs, chemotherapy has its own side effects as well. And some of the side effects may include low blood counts, loss of hair. That's very common. You see a lot of cancer patients with loss of hair, and also vomiting, diarrhea, constipation, a lot of things. And if you experience any of these side effects, all you need to do is to speak to your doctors and they'll sort it out. And if you are a woman, if you are a lady, if you are taking chemotherapy, make sure you don't get pregnant, because this could harm the child in you. And also, if you are a man, always avoid to get your wife or your partner pregnant. Like I said, it's dangerous for the baby inside the womb. So and then, of course, after treatment, the next stage is recovery. How do you recover from chemotherapy treatment? You have to, number one, you have to make sure you do a lot of exercise. You don't just sit down and relax. Even though you need to relax as well, you need to rest well, but you need to involve in a lot of exercise. You have to make sure you keep fit. You don't add up weight. Obesity is also one of the causes of cancer. In fact, it's the second cause of cancer in the UK after smoking. Smoking is number one. So, of course, you have to give up smoking. If you want to recover from chemotherapy, you want to avoid cancer, make sure you give up smoking completely. And like I said, the second one is obesity. Then third one is alcohol. You have to also reduce your alcohol intake. You have to, if possible, if possible, make sure you avoid drinking, avoid alcohol, and if you can't avoid it, at least reduce it. It's number third cause of cancer in the UK. So all these things you have to do. You have to exercise, rest well, eat balanced diets, and with this, if you do all these things, you recover, provided the cancer is at the early stage. So contrary to what that woman said in the video, chemotherapy is not the one killing people, it is the cancer. And like I said earlier, cancer, it's 4 stages. If the cancer is at stage 3 or 4 and you're taking chemotherapy, of course the chances of survival is very slim. It is very, very slim. But stage 1 and 2 is very treatable. So don't think chemotherapy kills people, because I've seen and I've heard a lot of people living with cancer. They try to run away from taking chemotherapy because they believe, if they take chemotherapy, they're going to die anyway. So what's the point? No, chemotherapy is not the one killing them. It is the cancer itself. So please don't listen to people who doesn't have idea of what they are talking about. So that is it all about, and it's all about chemotherapy, and that's it for on in this video. So please don't forget to subscribe to this channel, Owotune TV. Like the video and share it to your family and friends. Even though if they don't have cancer, at least they might know one or two people living with cancer. So don't forget to share the video. Thank you very much, and I'll see you in the next video. Bye bye.